a huge adrenal gland. And then this blue collecting system is the best. Okay, minor calyx. Major calyx would be in this area, it's hard to ask. But the big area is the renal pelvis into ureter. Okay. This one, good adrenal. Aorta inferior vena cava. The best thing about this one though is, and I bought it for the ureters and the bladder, which when it comes apart, either one of these, the white area is the trigone. The two circles at the top are the openings of the ureters. And this is the internal urethral sphincter. This is the urethra. So up here would be the internal urethral opening and sphincter. And then urethra. And here is transitional epithelium. And if I ask what is the muscle layer found here, that's detrusor. Okay. So that's this is the best model to ask bladder questions on. Okay. Let's go to here. This one got everything. This one is good for cortex, medulla with pyramids. Okay. Here's a renal artery. This is the collecting system, but it was better over there. And there's the ureter. Okay, so cortex, medulla, pyramid. Tip of the pyramid is called papilla. And actually right here you can see it going into a minor calyx. So that's a nice little section. This is the best one. This is a pyramid. So this is the papilla down here. This is the cortex. Blood vessels. Renal artery. Segmental over here. Then interlobar, and that's an interlobar here. Running on top of the pyramid is arcuate, and then coming off arcuate is cortical radiate. So you've got all of them on this. Okay. The round areas are the renal corpuscle, and here they show you the glomerulus inside, and there's Bowman's capsule. So on this one you can trace the entire tubular system. That's the Bowman's capsule, so this is PCT, this is descending limb of loop of Henle, hairpin turn, ascending limb of loop of Henle, distal convoluted tubule, and the big giant one is the collecting duct. So you could trace it on this one or this one. This one with the short loops is a cortical nephron. This one with the long loops is a juxtamedullary. So this little section right here is perfect for either blood vessels or tubules. Okay. Then you take one renal corpuscle, and that's what it is here. And this would be glomerulus. This is Bowman's capsule. This is proximal convoluted tubule, the only opening coming off of it. This would be the last part of the ascending limb of the loop of Henle, where it came down and came right back up. Okay. Like that, okay? These cells right here, well, then let me do this. This has a larger diameter, so that's afferent arteriole, smaller diameter efferent arteriole. In the afferent arteriole are the JG or granular cells. It's next to the ascending limb of the loop of Henle, so these cells right here would be macula densa. So sitting right next to each other. The coating on this glomerulus is showing the filtration membrane, so these would be podocytes. Okay. So I actually have some podocytes. So how many questions can I get off just this one little sucker? 6. Easy. All right, if you go over here then, having done that, this, again, this would be medulla going down to papilla here. This would be cortex, just blown up. This would be arcuate artery, so this has to be cortical radiate going out to the rim of the cortex. And you can actually see on here afferent arteriole, glomerulus, efferent arterioles. So I could ask them there. And the main thing on this one is to get the colors right, okay? If you look right here, I have a short loop cortical nephron. Here I have a long loop juxtamedullary nephron. On either of those, though, if you follow, here's the glomerulus. The orange represents the proximal convoluted tubule. It's not as easy to see, but then it goes down here. So this is the end of the PCT, and it goes down the descending limb, hairpin turn, ascending. So when you get to the purple, that's ascending limb of the loop of Henle, and distal convoluted tubule, and then it goes into the collecting duct, which is the big duct. Easiest way, find the collecting duct and go backwards. The only thing that enters the collecting duct is DCT, so then you can keep your colors great.
Okay.
The final thing on this one is, up here, this little network, capillary network, is representing peritubular capillaries. This network down here with the long loops of Henle is trying to indicate vasa recta. So if I ask, what is this capillary network, peritubular capillaries up here, vasa recta down here.
Okay.